Hi everyone, my name is Shaquille, and today I'll be walking you through 3 essential pillars of healthcare management: compliance policies, patient safety, and how quality can help control costs. Let's dive in. First, we'll talk about compliance overview and the various layers of compliance. Healthcare compliance operates on 3 levels: regulatory laws, accreditation standards, and internal organizational policies. Each layer plays a vital role in protecting patients and ensuring ethical legal care delivery. First, we have HIPAA. HIPAA is the Health Insurance Portability and Accountability Act. This mechanism is in place to safeguard patient health information, also known as a national standard for protecting patient data. It provides patients the right to privacy and sanctions rules on how healthcare professionals can protect their personal information from illegal intruders. Next, we have EMTALA. EMTALA is the Emergency Medical Treatment and Labor Act. This act requires hospitals to treat everyone requiring emergency healthcare treatment, regardless of their insurance status and ability to pay. This also allows hospitals to prevent any abuse of the law. Beyond laws, healthcare organizations must meet standards from accrediting bodies such as the Joint Commission, also known as TJC, and the National Committee for Quality Assurance, also known as NCQA. These accreditation organizations serve as benchmarks for healthcare quality improvement. Their standards guide organizations in implementing best practices for patient care and safety. Internal programs and oversight mechanisms, such as the 7 elements of the Office of Inspector General Compliance Program, are a set of guidelines that assist healthcare organizations in maintaining compliance with both legal and ethical standards. Now let's talk safety. These 5 areas: medication safety, infection control, surgical safety, patient identification, and fall prevention, are all areas where hospitals must be especially vigilant to protect patients from harm. For medication safety, we follow the 5 rights: right patient, right drug, right dose, right route, and right time. As healthcare has continued to evolve, so have the medication administration rights. I've seen as many as 7, 9, or even 10. In addition to the medication rights, we also have technologies in place such as the computerized physician order entry process, also known as CPOE. This process requires physicians to enter their orders electronically and bypass the process of giving verbal orders or written orders. This technology promotes safety by ensuring a clean and streamlined way of order entry. In addition, we also have barcode medication administration, known as BCMA. This technology is in place to require nurses or healthcare clinicians administering medications to patients to scan the patient's armband using 2 identifiers, typically their name and date of birth, before scanning the medication. And when scanning the medication, we are using the rights of administration to ensure that it's the right patient, the right drug, the right dose, the right route, and the right time. By implementing these technologies, we further have safeguards in place to minimize medication errors and verifying information electronically. In regard to infection control practices, the most important and effective way to prevent infection is through hand hygiene. We must also adhere to contact isolation and various other mechanisms such as enhanced isolation, contact isolation, drop-in isolation, or a combination of all to help prevent healthcare associated infections. By wearing our PPE, our personal protective equipment, when caring for these patients, we are promoting and upholding best practices. As with anything, ongoing education and compliance audits improve adherence, but also ensure safety for both patients and healthcare personnel. As previously mentioned, in terms of identification to promote patient safety, we must always verify the patient's name and date of birth, using two identifiers typically, and these are the two that we would use. We use the identifiers to ensure that we have the right patient and ensure accurate identification when providing care. This practice helps to prevent errors from occurring, enhances safety for patients, and support effective clinical decision making in the healthcare setting. In addition, implementing fall prevention protocols through appropriate screening, which includes evaluating medications, health conditions, as well as age and other non modifiable risk factors, are risk factors that can be changed. We can significantly enhance patient safety. We also have technologies such as virtual sitters or even bed alarms that we can implement to promote fall prevention within the healthcare setting. By systematically assessing risk factors and taking preventative measures, we as healthcare providers can reduce not only the likelihood of falls, but we can also improve patient outcomes and promote a culture of safety within healthcare settings. Quality isn't just about better care, it's also a smart way to control costs. Strategies like Six Sigma, which is a data driven approach aimed at improving quality and efficiency by reducing errors and defects, and Lean, which is a principle that focuses on eliminating non value added activities by streamlining workflows and reducing waste, lowering costs, and enhancing care, help us to be more efficient in our workflows. Value-based care ties payment to outcomes, and data analytics plus preventative care help avoid costly emergencies and hospitalizations. System-focused approaches in healthcare aim to optimize the entire system by considering the interactions between various components such as hospitals, primary care, and public health agencies. Collaboration across sectors, stakeholder engagement, and aligning policies and practices are key to improving outcomes and efficiency. Collaborative system integration involves bringing everyone together, including healthcare providers, payers, and policymakers, including our patients, to work toward common goals such as improved quality, efficiency, and patient care through shared data, aligned incentives, and new care models. Stakeholder-focused approaches prioritize the perspectives and needs of all involved, ensuring the system is responsive and inclusive through active engagement and feedback. Continuous improvement strategies such as quality and process improvements aim to drive ongoing progress and better performance. A shared vision unites all stakeholders toward a common set of goals, providing direction, building consensus, and guiding decision making to achieve a more efficient and effective healthcare system. Who doesn't want that? Here are the references used to guide this informational session today, and I hope you found value and learned something new. Until next time, take care. Thank you for your time.